What's great about online is that since you have access to everything, you can get ahead when you want to.
So I was terrified of doing the online program, but I quickly learned with Marquette that you don't feel like you're online at all. The teachers make themselves so available.
There are, virtual simulations. There's a lot of self-quizzing that you can choose to take part in. So they really provide you with a lot of ways to gauge your learning.
Skills Lab is where you get to put everything that you've been learning online into practice.
You go from learning how to wash your hands to learning how to palpate someone's pulse, how to listen to their breath sounds with a stethoscope, how to take their blood pressure. So it really helps you kind of take the nerves off.
Your Skills Lab professor is there to teach you how to form a nursing diagnosis, which I had no idea there was a difference between like a medical diagnosis and a nursing diagnosis before Skills Lab. Simulation is where you're taking like the skills that you're learning and you're applying them to how it would work in like a clinical situation.
So you're walking in and the sim mannequin is a patient. Like they actually talk back to you. They have someone behind them that talks back to you.
Puts you in those situations that you very well will experience in the clinical field, but doing it in an area where you aren't at risk of harming someone else if you make the wrong call.
It's awesome because you're actually interacting with real patients.
I think it's a great balance between lecture, lab, and clinical in-person with real patients.
I would recommend Marquette University's Direct Entry MSN program.